So I'm glad you all came. Thank you very much. And welcome to the Greater Yellowstone Fire Action Network. We're sponsoring this learning opportunity, Living with Smoke. We've got some great presenters tonight. Going to share this recording and the PowerPoint with all of you and with our network and other folks who are interested in this, the neighborhood ambassadors in particular. So I'll send that to you all via email, and please do share it around. Wildfire season's on the way, believe it or not. And hopefully this presentation is going to get you and others ready for a smoke event, if we happen to have one, and provide information to protect our loved ones, our pets, and our communities during a smoke event. Also, with the potential of a wetter summer, or at least the beginning of a wetter summer with all the snow we've had in the Greater Yellowstone area, land management agencies like the Forest Service, they might have some prescribed burns out there. And so part of this presentation is going to talk about smoke with prescribed fire versus wildfire. And we'll take your questions at the end of the presentation, but you're welcome to type them into the chat so you don't lose your thought. And we'll read those out to the presenters at the end. I'm going to introduce everyone. I'm going to start with myself. I'm Liz Davey, and I'm the project coordinator of the Greater Yellowstone Fire Action Network, as well as the Island Park Sustainable Fire Community. Tonight, we have some very knowledgeable guests who are going to provide the information on living with smoke and how you can deal with smoke and what it all means. And I'm going to let them each tell you a little bit about themselves as I say their name, and then we'll start the presentation. So Brenda, would you introduce yourself? Brenda, are you out there?
Hi, everyone. Hi, everyone. My name is Brenda Ramanathan, and I'm with the Bridger Teton National Forest with the AIR program, and I help Leslie when there is prescribed fire, and we monitor air quality during wildfires as well as prescribed fires. And if you have questions about air quality, contact me. Thanks.
Leslie, how about you?
Hi, everyone. My name is Leslie Williams Gomez, and I work on the Bridger Teton National Forest in wildland fire prevention. And I'm the wildfire prevention specialist for the Black Rock and Jackson Ranger districts.
And then I'm going to ask Paul to introduce himself as he's queuing up the slide presentation, and we'll go right into the presentation. Paul.
Okay, yeah, hello everyone. My name is Paul Corrigan. I am the Utah Smoke Coordinator. I work for the U.S. Forest Service officially, but also support all the land managers in Utah that do prescribed fire, whether they be other federal agencies, state, or private. The Forest Service, in recognition of the enormous impacts that wildfires have on air quality, has started to increase and have some in-house dedicated smoke people. So I'm one of the closest ones to the Greater Yellowstone area, and so I'm happy to be here to join the call and talk with you folks about wildfire smoke impacts and yeah, all the things that we do both for public health and for regulatory to try and minimize those. So I'm going to start off with sharing my screen, and I'm going to also include the sound and just give me a thought if you folks are seeing a slide deck. Okay,
Good.
Great. We'll get started. So we kind of have three focus areas for the talk tonight: pollutants and smoke. So just a little bit of sort of air quality 101, I should say. It's not 1-on-1, thank goodness. It's 3 on 10 tonight. Your health and safety would be one of the other topics, and then just as Liz mentioned, we'll talk about prescribed fire and how that fits into the pieces of the puzzle. But you'll see a little logo in the bottom left, Smoke Ready Communities. So this is not in a, this is a shared concept that's sort of partnership driven. And so we'll talk a little bit about that and how to ensure that, you know, we can be as responsive as possible for all the people we care about and reduce their impacts, the impacts of wildfire smoke to them. So getting started with what's in smoke from wildland fire. So it's a complex mixture. What you see in this smoke plume, the most visible part of it is in fact water vapor, right? But there's also a ton of other stuff in there. So the major pollutants is the one that we keep closest track of is particulate matter, also known as PM, and you'll hear it talked about by size class. So PM10 you might hear, or PM 2.5, and we'll get into what that means here shortly. But particulate matter is really the key pollutant of concern for a couple of reasons. One, the other pollutants, which are also not good for you, and if you know you're really close to the fire, those ones can have a significant impact. But particulate matter persists much longer in the atmosphere than the other gases that are produced by a wildfire. And so that's probably the biggest reason why it's of concern. And as a result of that, it can be transported significant distances, in some cases hundreds of miles away, or even thousands, as we've seen in the past couple of wildfire seasons, and still have major impacts on air quality at such a great distance from the fire. So that's why we really key in on the particulate matter. But just to do all these other nasties, their due diligence, carbon monoxide, another major pollutant in wildfire smoke, but again, dissipating very rapidly with distance away from the fire. So that's mainly a concern for our wildland firefighters, not so much for people outside that community. And then lots of other things that, you know, my background is in forestry rather than chemistry, so I wouldn't attempt to explain polycyclic aromatic hydrocarbons, but just to say that those and other organic chemicals, benzene, et cetera, are in smoke, and again, dissipating pretty quickly, but definitely have impacts for those actually fighting the fires, and something they want to be aware of. So why wildfire smoke is a health concern? The particles are tiny, much smaller than you know, a dust storm, right? You know, which is equally visible, fairly common in the Western US, but the smoke is definitely different for you and worse for you than a dust storm. Because they are so tiny, these particles go really deep into your lungs. So we'll just harp on those points a little bit, because they're really significant in terms of the impact of smoke on people. So you can see kind of the human hair there, 50 to 70 micrometers, and PM 2.5 is everything less than 2.5 micrometers. And in fact, most of wildfire smoke is even smaller than that. And then of course, just the fact that when those particles are so tiny, they go deep in your lungs. So dust, typically 10 micrometers, give or take, trapped in your nasal passages, and you eventually sneeze it out or blow your nose and it goes away. Whereas smoke goes all the way down to the deepest parts of your lungs and can cross into your bloodstream, cause systematic inflammation, but also can cause exacerbation for asthma, people with COPD, other types of pre-existing heart and lung conditions. So we'll explore that concept just a little bit more, and you can see here along the scale of really small things. Here's your wildfire smoke right there, and they're, you know, broadly giving it a range even less than 1 micrometer, but certainly there's pieces that are even bigger and smaller than that, but the bulk of the smoke is in that range there. And here we see kind of that diagram again. Anything larger, 10 micrograms, 10 microns across, I should say, really does not typically go past your throat or the very upper branches in your lungs, whereas smaller particles cause those lung problems, those heart problems, and can cross into the bloodstream and introduce harmful chemicals there. So rock solid relationship between wildfire smoke episodes and increased sickness, ER visits, and even unfortunately deaths when we see those conditions persist over many days or even weeks, which has been unfortunately the case in some recent summers. The only silver lining here, I would say, is that because it's a physical, process, it's not going to sneak in through your eyes or your ears and cause you problems. There are ways to protect yourself, right? Like, preventing those particles from physically going into your lungs can be done and should be done. So we're going to watch a video here in a minute, but just for the highlights are, make your home as clean as possible, right? That's really what the first two graphics here are showing. This person is beefing up the barrier between the inside of the home and the outside of the home, right? So those smoke particles don't infiltrate. You can clean the air in your home with certain air cleaners, right? HEPA to be specific, right? You'll want to see that HEPA acronym on your air filter in order to capture those really tiny particles. If you don't have a filter of that fineness, then it won't do the trick. So you need a HEPA air filter in order to make a difference in reducing those fine particles. An N95 mask is also extremely effective at this, and so in the wake of the pandemic, everybody knows what that is, and many people have already practiced wearing them. So we'll talk about that just a tiny bit, but some of the key points there are ensuring a good fit. It really doesn't work if you have a big bushy beard, etc. So keep in mind those points. And then lastly, and probably most important, you'll see many ways in this presentation in which you can keep track of the air quality index. Wildfire smoke is not generally a constant throughout the day. There's usually peaks and valleys even over a single day. And so being aware of what that is in your location and taking steps to protect yourself, or then finally realizing, oh, it's cleared out this afternoon. Now is when I really need to walk the dog, mow the lawn, do my things outside that I need to do. You can really reduce your exposure just by keeping track of that. Okay, so this is the air quality index, and I will just zoom in on a couple little sections of the slide so you can see that we have the color system, right? Green, yellow, orange, red. Each one of those also comes with an adjective: good, moderate, unhealthy for sensitive groups. It comes with a number. The numbers can be a little confusing because the air quality departments will sometimes report their number in the terms of concentration of PM 2.5, but the intent of the air quality index is to make this a unitless, easily rememberable, easily digestible tool to convey the risk to folks. So if you hear of an air quality index over 100, then you're not in the good or moderate range. That's kind of the intent of having the scale this way. So always double check what the units are, because if you're looking and it's reporting in PM 2.5 micrograms, it's a completely different scale, even though the color codes are still appropriate. So just to consider that, and that's always communicated by our air quality departments. If you're looking on their web pages, they will tell you which scale they're using, AQI or otherwise. And then of course there's this description. So I won't read them all by any means, but you can see as you go down to the worst case, maroon, everyone is more likely to be affected, right? Okay. Any questions on the air quality index before we jump into the next step, which is kind of looking at ways to keep track of that?
And if you have a question, feel free to unmute yourself and just ask the question, or type it in the chat and we can read it out loud if you're shy.
Yes, I have a question. How often are air quality reports updated?
Oh, okay. Yeah, great question, Janet. There are there are avenues in which you can just go and look at and see what the sensors are reporting in your neighborhood, and those are updated generally hourly. There are also sometimes formal sort of, here's today's forecast produced by Idaho DEQ, and that would be more typically something that might just be done once a day.
And then Bobby was curious about who issues those air quality reports.
Yeah, thanks, Bobby. We'll get into that a little bit on the next slide. It's typical for a state, you know, whether it be Idaho, Montana, Wyoming, Utah, what have you, to do something on a sort of a daily cycle for issuing them. And occasionally there will be also reports issued by or from a large wildfire. So I'll show that next. So this is really our key go-to data source that we promote a lot, fire.airnow.gov. And this is just a screenshot kind of what it looks like, but we can see there's a lot going on in this map, right? So we've got all the little sensors and monitors. These are generally being updated on an hourly basis. There is a difference between the circles and the squares and the triangles. And it's probably, you know, of interest to the group. So the little squares are low-cost sensors, in essence, a citizen science effort. And these are, for the most part, called purple air sensors that are available for anybody to purchase, and they cost a couple $100, and you can hang one on the outside of your house if you wish. The circles are permanent regulatory monitors run by the state air quality agencies, and the triangles are temporary monitors, which could be operated by many people, potentially the Forest Service or potentially the state regulators. And they may be stood up temporarily for 6 months or a week. It's hard to say what the timeline would be for how long those are lasting. Another thing that you might notice is this blue box here in Oregon, and that indicates that on this particular day, which was last summer, there's a special air quality forecast just for that subset of the state of Oregon. So you won't always get that, but you may see that box, and you may have it around your location. That will take you to a more detailed forecast. And here's kind of an example of that. So this is issued once a day, and it looks like it's coming from a fire in Central Oregon, and including half a dozen nearby cities: Eugene, Crescent Lake, Lapine, Bend. And it talks about not just the air quality for the day, but what's projected for tomorrow, as well as kind of a little bit of a estimate of which part of the day will be best. In this case, night, right? But best is relative here. It's only going to get it's only going to be as bad as red air quality at night as the forecast for the state in Central. And many other things you'll see on this that are available through the fire.airnow.gov include this trend, right? So you can see how it's gone up and gone down, and that's really a really typical pattern that we'll see, especially at night. Dispersion tends to be worse. You have less wind, and so smoke hangs out closer to the surface. But not always. Sometimes night is the better time, as was projected for this forecast. So there are a lot of those low-cost sensors out there, but you may still be in an area that doesn't have anything nearby. And smoke can vary dramatically from one valley to the next. So another way to, you know, have an assessment if you don't have any sensors near your neighborhood is simply by visual. So we can see a clear day, 5 miles. Not so clear day if you can see 3 miles, or if you can see less than 1 mile. And again, they're just keeping it really simple New Mexico put this graphic together, but the state of Montana also supports something similar in terms of actions to protect yourself when these are the visibility levels, and those would track pretty closely with the actions to protect yourself based on air quality index. Okay, so I'm going to hit play real quick on this lung association video, and I think I shared my sound, so I'm hoping that you guys can also hear it and start waving like this on the Zoom if you don't hear the sound here when I hit play.
With wildfires becoming more common, it's important to know that smoke can harm your lungs and cause breathing problems for everyone, especially kids, older adults, and people with asthma, lung disease, or other health conditions. How can you keep your lungs safe around wildfire smoke? Unless you need to evacuate, stay inside with your windows and doors shut. If you can, use a HEPA air purifier to filter out harmful particles. If you have to be outside, wear a fitted N95 mask if possible. Always keep an eye on the air quality index. The AQI shows how much pollution is in the air and if it's safe to go outside. It's especially important to prepare if you have lung disease. The American Lung Association encourages anyone living with a chronic lung disease to keep all medications, delivery devices, prescriptions, and insurance cards in one spot so you can evacuate quickly if you need to. If someone in your family uses an oxygen device, notify your utility company so they're aware of the need for priority electricity supply. A portable oxygen concentrator allows you to bring it with you during an evacuation and can even be plugged into the DC outlet in your car. Visit lung.org to learn more about wildfire smoke and how you can protect yourself. Or call the American Lung Association's helpline at 1-800-LUNG-USA to speak to a nurse or respiratory therapist.
Okay. So yeah, really succinct, but also really useful advice. And there's all of those things are key measures, right? You don't want to add to indoor air pollution if you possibly can. The one thing she probably didn't go into is a little bit about more about maintaining the indoor air quality in your home. So during a wildfire smoke episode is not a good time to fire up the vacuum cleaner or use the Fry Daddy to make French fries, or burn a bunch of candles in your house, because you're already going to have this significant background outside load of smoke. It's challenging where we are in swamp cooler country in Utah because you need to keep cool, but at the same time you don't want to bring a bunch of outdoor air into your home. But that's something to consider. Many communities do sort of have facilities where you might be able to also get a break. So whether that be a library, community center, etc., with a decent HVAC system and air conditioning. Underneath here, and we'll make this all these links available at the end to everybody, so not to worry. A more in-depth summary of the research and kind of a literature review of wildfire smoke, but also crossing into the question of, well, wildfire smoke is so bad, why are we doing prescribed fire? Because that smoke is also bad, but it gets into a little bit of the trade-offs there in terms of the benefits of prescribed fire for reducing the potential of large long-term wildfires. So really, that's my piece. I was gonna turn it over to Leslie for a few minutes to talk about smoke from a prescribed burn and why we have prescribed fire programs, et cetera, et cetera. So let me know if that sounds good, Leslie, and I'll just keep clicking ahead if you say go to the next slide.
Great. Thank you, Paul. Very interesting. And thanks again, everyone, for joining us this evening. So the question is, can prescribed fire mitigate health harm? And it can. And we see that through some of our practices with prescribed fire. But let's talk a little bit about prescribed fire. We've heard about wildfire and the harm that it can do. And we all know that wildfire is an important part of our ecosystem here within the greater Yellowstone area. We are a fire adapted ecosystem. We do need fire to help remove the fuels and the hazards that threaten our communities. Wildfire composition can vary between wildfires. The smoke can be really heavy at times and very impactful, as we see in the summer months where we can't even see the mountains around us or so on, or it can be light. We find, and well, let's get into what a prescribed fire is. So a prescribed fire is a fire that is identified as a management strategy to help mitigate either fuels mitigation, fire hazards adjacent to communities, also wildlife habitat improvement, to name a couple of the objectives there. So it is an important part of management to have prescribed fires. Although it's not as easy as just going out and dropping a match. Fire managers have many people that they talk to and plans that get coordinated before a match touches the ground. And one of those important conversations is smoke. Okay, so air quality specialists are also involved in the prescribed burn plan, and they help us to identify strategies for mitigating the smoke that might impact a community negatively. So some of those things that we look for when we're implementing a prescribed fire and writing our plan out is, you know, where's the smoke going to go? There's many things that need to go into our thoughts as we're putting fire on the ground. Do we have a good clear day? Or is this, and we have good wind flow, or is the smoke just going to settle in and impact our community in a negative way? We don't want that. Prescribed fire is actually one way we can control the smoke far more than we can during a wildfire. So there's different strategies such as the airflow consideration, also looking at the time of day. We often, during a prescribed fire, will stop burning around 2 or 3 in the afternoon because in the winter months, because we don't want the cold air to sink that smoke into our community. So we have time frames that we follow to minimize the smoke impact. We also reach out to our air quality folks, and we get burn permits, and we make sure that we don't put too much smoke up into the air. And we look at tons per acre and how much emissions is going to be put into the air during our process. So temperature has a lot to do with our burn strategies. We also communicate and notify the public before a prescribed fire, so that the public can take the necessary steps to prepare themselves for smoke. We've had individuals where we've known that it was going to impact them negatively, and we've worked with them, and we've come up with a strategy to keep those individuals safe. We also evaluate, as I said, the smoke dispersion conditions. We don't want smoke settling into our communities. We want that good airflow. We want a clear sky, high winds aloft that'll carry that smoke out of the community. We also monitor the effects. We'll set out smoke monitors in the burn area, and we'll also monitor with photographs and seeing how we're impacting the community, and then adjust our burning operations accordingly. And we consider emissions reduction techniques. So we may use different burn strategies to control our the emissions we're putting into. Here, I'm going to move that for a second. I'm sorry. into the air. So, and then we also share the air shed in coordination with other burners in the area. So for instance, here in this area, we won't have 3 or 4 prescribed fires going on at one time, because that is just too much smoke that we're emitting into the air. So we'll identify and triage the projects accordingly. So, managing smoke is an important part of wildfire management, and protecting human life is the foremost priority in all aspects of wildland fire management, and that does include the smoke. And then we have a video here for, Paul can hit that for us. Thanks.
Fire has always been a part of the environment. Under the right conditions, fire can even provide important benefits to the health of a forest or grassland. However, in recent years, wildfire seasons have grown longer and more destructive. The Forest Service and other land management agencies are working together with local communities to reduce the threat of wildfires and help communities become more prepared and resilient. Prescribed burning is one of the most important tools land managers have to do this. A prescribed burn is a planned, low-intensity fire conducted by trained professionals who control the conditions of the burn. Prescribed burns are shorter in duration and conducted under weather conditions that minimize the impacts of smoke to the public. Today, many natural areas are overgrown and dense with thin trees, too much brush, and too many dry leaves, twigs, and needles. When fire occurs in these areas, either from lightning or human activity, it can spread quickly and threaten nearby communities. Conducting prescribed burns in areas like these at the right time and under the right conditions not only improves forest health, but reduces the threat of future wildfires and also gives firefighters safer places to work if fire does occur. During a prescribed burn, avoid the area to keep yourself and the firefighters safe. Smoke from prescribed burns is often minimal to moderate, but if you're sensitive to smoke, lessen the amount of time spent outdoors and avoid prolonged physical activity in smoky areas. Inside your home, keep windows closed and if necessary, use air filters or set your air conditioner to recirculate inside air. Listen to your body and contact your healthcare provider if you experience smoke-related symptoms such as eye, nose, and throat irritation, coughing, wheezing, shortness of breath, or headaches. Smoke impacts from prescribed burns are temporary and manageable compared to large, unplanned wildfires that can produce thick smoke for long periods of time. By working together to conduct more prescribed burns when the conditions are right, we can improve the health of our forests, reduce the threat of future large wildfires, and strengthen our communities.
All right, great. Thanks for that video. Yeah, we do need support from our communities with our prescribed fires. I do see a question in the chat, and when doing prescribed fires, how are the impacts on wildlife and plants taken into account? Great question. As I mentioned, we just don't go out and decide that we want to burn an area. It takes a few years to come up with that plan, and there's a process, and it's an Environmental Protection Action Process, NEPA. And so when we are coming up with our prescribed fire, our prescription, we include wildlife biologists, and they're going to explain and advise us on how much fire to put on the ground, what the effects are going to be that will be the threshold for negatively impacting wildlife. And then we also have botanists and soil scientists to help us understand that threshold and that prescription for the fire. So just like your doctor will write a prescription for you to be healthy and to feel better, these specialists help us understand what our parameters, our prescriptions are for how intense that fire should be and how that will impact wildlife and plants, as well as smoke. Any other questions before we move on to the next slide? All righty.
So I think this one's mine. Does that sound right? Talking about the low cost air filters.
You got it.
Okay. You do not need to spend a bunch of money to improve the air quality in a room in your home. Essentially, all the air purifiers that you can buy, you can get them on the internet, you can get them at a box store like Walmart or Target, are just this, a filter and a fan. So you can just buy the filter and the fan separately and make your own, to be perfectly honest. And they work just as well. The EPA has done a bunch of studies on these. So a 20 by 20 inch filter and a standard 20-inch box fan, square box fan, and a roll of duct tape will create a functioning room air purifier. It'll only cover, you know, a typical sized room. So there's a certain number of square feet and I forget it exactly off the top of my head, but you could use this in your bedroom or your living room in most homes, and it would work just as well as one of the commercial ones. So in this case, you're going to be spending probably $40 instead of maybe $100 or $150 for one of the pre-built models. The other nice thing about this is, you know, you'll be able to find that furnace filter again when it comes time to replace it. That's one of the challenges with the store-bought air purifiers is the business model is the unit is cheap, but when it comes time to replace the filter, they might sock it to you on the price. Whereas in this case, you just peel off the duct tape and go get a new one. Don't use the oldest box fan in the family. Don't use one from the attic or whatever that's been there for 40 years, but any box fan that's been made in the last 20 years or so, they've tested and they have not been able to get them to catch on fire or short circuit or anything with this method. So the newer box fans are safe for this purpose. If you have a really old one, don't use it for this. So really, that's just something we share because it can be, the uptake on this has been really phenomenal when we started sharing this around the wildfire smoke events and in communities, because people don't always have the means to retrofit their HVAC system at their home, right? But a lot of people can afford this or find some way to improve the air quality without spending a whole lot of money in their home. Any questions on this one? Cool. And just the very last page is a series of links. We mentioned the fire and smoke map. We kind of showed that one. The one at the bottom, Montana wildfire smoke. Montana has done a great job of revamping their public communication on this, and we'll be posting timely messages on here during wildfire season should smoke reach higher levels around the state there. But also lots of other really good things in terms of resources that folks can share with others in their community and things to help educate yourself a little bit more on the issue. And again, this will all be shared as well, all the items on this page. So we'll get the slides out for the group for anybody who would like to review them. And lastly, we have our contact information here. So yes, feel free to email me at any time, and I'm sure Brenda and Leslie and Liz feel the same way.
Excellent. Thank you very much, Paul and Leslie and Brenda, for listening in. So Janet asks, how are members of the public notified about prescribed burns? That's to you, Leslie.
The Teton fire.
Yeah, so that's a great question too. We do want to make sure that the public is notified prior to any any prescribed fires. And so we start off with a press release, and that'll be put out in the newspapers. We may try to do interviews on the radio to let the public know. We'll put signs up in the information boards up in the fire area or adjacent to the unit. We also have, for us locally here, we have Teton Interagency Fire website that has prescribed fires, our project page. And then depending on the agency, it'll be at the district office or the SO or the BLM. And for instance, when we do prescribed fire and it's a habitat fire, we work closely with Game and Fish, and they'll help with that message, as it's one of their objectives to get healthy habitats through prescribed fire. And I will say, you know, that's a benefit of being an ambassador, because I know here in Teton County, we try to make sure that all of our ambassadors get information on our prescribed fire and our fuels mitigation projects. Any other questions?
Someone
I
have
do
their
like
hand
talking-
raised. Go ahead and unmute yourself and speak up. No. No more questions this evening? No curious people tonight, or few?
I don't know if I mentioned in regards to the prescribed fire. You know, we tend to burn when conditions are less. Oh, another one. Oh,
There's a question from Bobby.
okay.
Do prescribed fires eliminate spruce budworms? I can answer that one.
Yeah, go ahead, Liz.
No, they don't. And in fact, the results of a spruce budworm attack can enhance fire behavior because it kills the end of the spruce stem. It eats those primary terminal needles. So no, it doesn't eliminate spruce budworm. There's not much that eliminates spruce budworm. You can spray an insecticide on individual trees. You can aerial spray for spruce budworm. But when it comes from the national forest or other public lands, the Forest Service isn't going to spray for spruce budworm. It's a natural occurring insect in our spruce and fir, and it creates more fuel. That's for sure. Does that help you, Bobby? Any other questions? Okay. If not, I thank you all very, very much for attending. I will send out the recording and the slide presentation. Feel free to share that with your neighbors, your friends, your colleagues, and stay tuned for our next learning opportunity. Bobby, did you have another question? I see your hand. Okay.
Yes, is there a chain of command when there's not a controlled burn, but when there's a wildfire in terms of communication? I was delighted to hear all these opportunities for finding out stuff, but sometimes that can be confusing for people. And I wondered, when there's actually an emergency, if the U.S. Forest Service is the pinnacle of the chain of command, or there's some state arrangement instead.
All yours, Leslie.
Okay, yeah, that's also a great question. So we'll often work in a unified command and work together in the messaging. If it's strictly, for instance, a fire, I'm just going to use the Bridger Teton as an example. If we have a fire up in the Teton wilderness, we're going to manage all that that fire information out of our house here, and that's going to be through our website, through social media, through press releases. We'll also use INCI Web, which is a fire website that posts information incidents on all it's usually fires over 100 acres get posted on INCIWeb. And we'll just work together that way with signs on the ground and so on. But if you see smoke and you have a question, you know, I guess I would start with the air now, kind of see what's happening and start there and minimize, go down and in and see if you can find out where that that fire might be coming from. And then also look into, you know, that particular forested area or that particular community and see if you can find something out that way. Does that help?
Well, yeah, and Pat added some information in the chat and just saying it'll be great to share this information, especially about the air filter, do it yourself. So that's great. Share it with your neighbors because smoke is inevitable. I mean, this summer, and it may not even be coming from this area. It might be coming from some distant place and we won't know much about it except for there's smoke in the air.
Mm-hmm. Liz, while we have a second, do you just want to touch on how like the network is looking forward to building a living with smoke sort of program, and we'll have talking points coming out and some more information in regards to that?
Smoke's a big deal for everyone. It's important. It's something that affects all of us, regardless of our health status. And it affects what we do every day. Most of us live here because we want to go outside. So yes, with the network, the Greater Yellowstone Fire Action Network, AWPAC, TAWPAC, Island Park Sustainable Fire Community, we'll definitely be sharing lots of information around. You might get multiple emails that say the same thing. Don't get frustrated, share them with your networks as well. Whether that's a neighborhood program or your friends or your family, we really want to get information out and we want people to be as well informed as possible. And to that, we are going to have another presentation. It's going to be on defensible space and home ignition zones, and that's going to be on April 25th. And it'll be about the same time, 6:30 in the evening. And I will share out to all of you as well as the rest of our networks the Zoom link for that. We're going to have a couple videos that talk about those items and then have an expert panel that will answer people's questions. So when I send that out, please share it with everyone else. I'll probably send the Zoom link out about a week before the event. Thanks, Bobby. If there's nothing else, enjoy the rest of your evening, and I hope you get to eat dinner if you haven't done so already. Thank you all very much and have a good evening.
Thanks, guys.
Thanks everyone for taking the time.